Good afternoon. It's a pleasure to meet you. I am Seong from South Korea. My topic is HIFU treatment for 14 years. I am the first Chungching HIFU doctor of Korea and the first gynecologist HIFU doctor of Korea. I have been treating uterine fibroid and adenomyosis by HIFU for 14 years from 2010. I hope my experience may help you take care of your patient in your hospital or in your clinics. Generally, if a surgical treatment is decided, there are many cases which hysterectomy is performed because it is difficult to preserve the uterus by surgery. But HIFU treatment is good treatment method for these to preserve the uterus. Until recently, I have reported some articles and books of HIFU. The most important thing to preserve fertility is to preserve uterus. When uterine fibroid and adenomyosis diagnosis and required treatment, a decision must be made whether to preserve or remove the uterus. In the cases of reproductive age women, the uterus should be preserved for fertility, and perimenopausal women, the uterine preserving treatment is recommended to prevent the sequelae of hysterectomy. When most gynecologists consider the surgical treatment of uterine fibroid and adenomyosis, they usually decide hysterectomy because it's difficult to preserve the uterus by surgery due to the size and location and numbers. That is the reason why hysterectomy is usually performed. However, these cases, HIFU treatments can be very helpful. These articles are safety and the efficacy of HIFU. The first article is published in 2015, and second papers was published in 2019. This data is a follow-up result of post-HIFU treatment for uterine fibroid. The result shows improvement of volume reduction and the symptom severity score and increasing life quality. This data is a follow-up result of post-HIFU treatment for adenomyosis. This result shows improvement of volume reduction and symptom severity score and increasing life quality. Here I prepare some cases which was diagnosed to get hysterectomy by most gynecologists, and I successfully treat these cases by HIFU. This case is a cervical uterine fibroid. The cervical myoma is growing at high vascularity side of uterus, and its nature was very soft. Myomectomy for this case is very difficult. Also, HIFU treatment of cervical myoma is somewhat difficult, and the recurrence rate is higher. At first time, she received HIFU at other clinics. Previous HIFU treatment was incomplete. I using GnRH agonist for 3 months before HIFU, and then lesion over 95% was treated. After 6 months later, the lesion was decreased up to 2.5 centimeter. The lesion about 90-70% was decreased. These cases are multiple fibroid. The different fibroid varied widely, and there are more than 20. If you meet patients like these cases, I recommend using GnRH agonist about 2 or 3 months before HIFU, and then enough If sufficient cavitation effect can be given to all myomas, treatment will be successful. This case is a 13 centimeter adenomyosis case. She was virgin and not married. Before height, I used GnRH agonist for 4 months, and I ablate the adenomyosis. 5 years later, uterine volume reduced by 83%. She feels good, very good, and she is satisfied preserving the uterus. Severe menorrhagia and dysmenorrhea was disappeared. This 12 centimeter diffuse huge adenomyosis, she received 3 times in vitro fertilization for pregnancy. Superovulation injection made adenomyosis worse. After HIFU treatment, volume reduced by 87%. After HIFU treatment for adenomyosis, the volume reduced by 80-70%. HIFU treatment for adenomyosis is the best treatment of choice except hysterectomy. This case is a combined submucosal fibroid and diffuse adenomyosis case. She had been DM and her hemoglobin level was 7. Level no gesture IUD was inserted in uterine cavity. Submucosal myoma and diffuse adenomyosis was shown in MRI. Usually, most gynecologists treat by hysterectomy like these cases. I think that HIFU treatment can be a good treatment modality for these cases. After 9 months later, myoma was disappeared and the uterus size was normalized. She had a huge multiple uterine fibroid and 7, 6, 5, and 4 centimeter size because of multiple uterine fibroid. Uterus was enlarged up to 14 centimeter length. I treated over 95%. T1 enhanced MRI image shows well-treated state. 15 months later, uterus was decreased up to 7 centimeter. All myoma was non-enhanced state and no new lesion in follow-up MRI image. It was very good post follow-up state. This article is published in 2018. The title is Unintended Pregnancy and Safe Parturition Following HIFU Treatment. And this article is published in 2017. I checked the MRI biomarker for ovarian, AMH biomarker for ovarian reserve before and after HIFU. So we conclude that HIFU treatment do not affect ovarian function. This article is a HIFU treatment for placenta previa, placenta accreta in 2016. I have experienced 2 cases of retained placenta accreta. In my experience in the uterine fibroid after HIFU treatment, fertility improved because the normalized uterus and the adenomyosis. The disease progression of adenomyosis before HIFU treatment was the most important factor for fertility. HIFU treatment was with very good therapeutic effect and acceptable side effect for uterine fibroid and adenomyosis, and is best non-invasive treatment so far. Generally, when gynecologists consider the surgical treatment of uterine fibroid and adenomyosis, hysterectomy is more often confirmed because it is difficult to preserve the uterus by surgery. For this patient, HIFU treatment is very helpful for her to preserve their uterus. Enough experience and training are needed to make satisfactory treatment outcome is most important. The successful HIFU treatment outcome totally depend on the doctor's ability and experience. I really appreciate your attention. Thank you.